All right, so I'm recording now. So tonight I have with me Shila LaGrua, who is one of my teachers and friends from the Center for Neurosomatic Studies. So Shila, can you give a little bit of background on your history and how you ended up becoming a neurosomatic therapist?
Well, I'll try not to take too long with this long history. I'll go back to when I was a dancer. So I grew up training for dance, and I ended up going to Julliard, and I danced professionally. So I spent the first 35 years of my life really getting to know the body and training in every way that possible that I knew that could support what I was doing. And a lot of touring, but also I was a modern dancer, so we didn't have a lot in the way of body work. We weren't offered. Whereas ballet, if I went the ballet field, that they offer things like that in companies. So for us as modern dancers, at least in the company I worked for, we really had to take care of our own injuries. So that's when my interest in really alignment and what's going on was important to me. I had rehabilitated almost all of my injuries aside from my surgery, just with alignment and a ball and a foam roller.
Oh, wow.
and I had a ton of injuries. So I was getting to the point with my leg length difference, which I'll get into a little bit, where my pelvis was in constant pain towards the end of my dance career. So I wasn't able to rid myself of all of the pain and injuries, but the only way I could function was I was working on myself, and I learned about my own trigger points. I found attachments on the psoas that I didn't, I didn't know what it was until I learned about it. Like, that's what that is,
Wow. So you were digging around in your own belly?
Yeah, just my intuition, like that has to release. So I was working with trigger points way before I was a therapist, and then I had to supplement my income as a dancer. I taught yoga and Pilates. And along with that, I also got certified in Thai yoga massage, and I was really interested in the Thai yoga massage was more about how I can help people with hands-on adjustments in yoga and Pilates. And then that evolved to more interest. And I didn't know really what I was doing it for, but I kept taking trainings, and I didn't really have a plan because I was still dancing. But towards the end of my career, I just knew I was creating a little bag of tricks to have so I could create my second career. And that's what I was doing. So by the time I got to back home to Florida, that's where I met Paul St. John. And I got interested in really pursuing this as a career. But first, because it was, I had to come as a client. I was a patient. So when I met Paul, that's what got me into kind of really, he clarified it for me, because it all came down to, I always knew it was about alignment, but it all came down to this leg length difference where I had all these issues of alignment, but the leg length difference was not allowing me to access the alignment correctly. And I knew that the alignment wasn't able to be accessed neurologically because I worked on things. I worked, for instance, on my longer leg, which is usually an adduction just because of the placement of the pelvis. I worked on that abduction constantly. I worked on my short leg's adduction. I worked on these things to prevent injuries. So I was already working against my distortions, knowing that I couldn't fire these muscles. Why couldn't I fire these muscles? Because my bones were inhibiting it. My bones were in the wrong place. It was totally inhibiting it. So when Paul was able to point this out to me in one session, one chart, and it just a light bulb went off in my head. And I was like, I got to learn this stuff. Because at the time I was retired from dance and just teaching yoga and Pilates. And this was the next step to get rid. I was really excited about it. The teaching was great, but it wasn't exciting me to the point of opening a door of knowledge, like to learn more. It always is there for me, and it still evolves, all the teaching, but at the same time, this was something new. So I was really ready to jump in. And that's when I learned about the school, the Center for Neurosomatic Studies. And it was really serendipitous the way it all worked out. Was that enough of my history?
Yeah, that was great. There's a lot of stuff in there that I hadn't realized. What kind of pelvic pain were you having, just out of curiosity?
So I knew I had a leg length difference. That's something that I wanted to mention. Before Paul validated that for me, I was actually on a quest to find a doctor that could work with my leg length difference when I was in New York, and I didn't find one. In fact, I got sometimes ridiculed for thinking that this is a problem, actually. And I got laughed at by some of the doctors. They're like, wow, you have, this is your range of motion, and why are you here? Like, it's like they didn't understand that I was just trying to figure out my asymmetry. And I kept looking in the wrong places. But your question was about my hip pain, right? My pelvic pain.
Yeah.
It got to the point where my acetabulums were, so I was wearing down cartilage. You could see it on my first x-ray. I did not have a lot of cartilage, and it was definitely wearing unevenly. I had a bone spur on my my longer acetabulum, my longer leg, as if my hip was trying to create a wider cup.
Okay.
Yep. And I didn't know that was there, but I'm sure that was part of the pain, but it was an aching pain. So after the shows in particular, my legs, and I think it's a lot of what's described as restless leg syndrome as well, but my legs would reverberate almost like you hit a cymbal. And it felt like wah, wah, wah. Like I was in the middle of this giant cymbal, and my trochanters were like this.
Oh, wow.
Very achy. It wasn't acute feeling. It wasn't sharp. It was achy, but then I got to the point where I was getting stuck. So I would get stuck in 90-degree hip flexion.
Oh, I see.
So it would take me, and it wasn't just my psoas or whatever, so it was like my cartilage or my joint was just, if I were in that position for any period of time, it would just kind of lock up. So I knew at that point, if I had gone conventional, it would be bilateral hip replacement.
Yeah.
Because they were just, I think they often tell people when you get to the point that you can't stand the pain, that's when I wasn't anywhere near that point, but it was progressing.
Yeah.
Yeah.
Wow. Interesting.
Mm-hmm.
All right, cool. Okay. So one of the main reasons I wanted to talk to you, was because I know you worked at the St. John Clark Pain Treatment Center. Was it for like 5 years after graduation?
5 or 6.
Okay. And then from there, you went off to start your own practice. And I love the way that you have your clinic set up, because you have the 2 treatment rooms, and then you have a class space or a studio space. And I was just wondering if you could talk about that transition from working for somebody and what you saw as the benefits and drawbacks to starting your own business, and now that you've been in it for, is it a year and a half or?
Almost. Yeah.
What you see as the benefits and drawbacks of that scenario, and just kind of anything you've learned along the way. Because my dream someday when I gain more experience, I like that model a lot, because I like to teach yoga and movement as well. And I love to learn and to take workshops and trainings. So I love to host stuff like that as well. So just from purely selfish reasons, I'm curious to see what your journey has been like.
Well, so I had a business before this one. It was a small yoga and Pilates studio. It happened to be the same space that I'm in now.
Oh, okay.
But not renovated to the point that we have it now. And it's funny because when I had that space, I remember it was very small, and it was supposed to be mostly me as a private teacher, not like big classes per se, mostly because of the space and what it allowed. But the drawback for me was that I wanted a community. I wanted fellow teachers, and I wanted people interested in what that was the one thing I kept hearing in my head, this needs a community. This is why I felt alone. Let's just put it that way. I felt very alone. So that was one thing that when I started Body Center, I was very interested in building a community. I just didn't want to go at it alone. And that's kind of been what's been driving me behind my mission, is that it's like a team approach. And along with that, that camaraderie you get in in classes and group classes or working out next to someone or, that physical effort. I think that also requires a bit of almost like that group approach brings the energy
Mm-hmm.
to it. When you're on your own practice, your own yoga, whatever, it has definitely its value. But when you go to a class or go to a practice, that has a different energy and you almost work differently in your body. So I really wanted that feeling and that vibe around that, it's like you look over here and there's action and there's, we're figuring out a pelvis thing and, gait, and it's just all this stuff around bodies and excitement around alignment happening at the center. So that was my vision. And I came from a wonderful Pilates studio in New York called the Kane School of Core Integration. Mm-hmm. And it's now called Connected, spelled with a K. And it's changed owners since I was there. But what a wonderful place. That's how that place was. It was really intelligent movement, using the Pilates method as a vocabulary, but this was like a rehab center. We had physical therapists, we had dancers, we had all the Pilates, and we had every prop known to man, like right there. And just, it was very active and inquisitive and just a lot of learning and curiosity and the whole library of books. And, it was a wonderful place to start planting my seeds. Mm-hmm. And then, so when I decided to shift gears out of St. John Clark, I went from just having to show up, you show up for your time slot, to working 24/7, because that's what it feels like.
Yeah.
But the difference between my last company, my last business, and this business is, I really love this. I love what I created. Uh-huh. The last one, it wasn't what I really wanted. So to think about being there to have the thought of like the demands of the job being 24/7, it wasn't worth it. That to me, it just didn't work out that way. But because the demands are like that, I've had floods, I've had, 2 big floods, actually. I've had issues with air conditioning, toilets. These things happen at crazy times. And I remember it rained for 3 days. We were getting our roof redone and we had a lot of leakage. And literally I was on call, like midnight. If we had a heavy rain, I had to get there and get with the towels and get with the mop. And otherwise my floor was ruined. So yeah, I had to do that for a few days. That was just insane. But those are the things that make it 24/7, or if someone's sick or someone's flight, all this has happened, someone's flight is delayed, then you just really have to get on your game. And I don't really have a front desk person per se. I do have someone that works with me remotely, which I'm happy to answer some of those questions, because that has helped tremendously, because it's a little bit scary to start to divvy out your responsibilities, because then you're not, in terms of like being the owner, then you're not making that income. But that's the key to growth. I think you have to have that support system to grow. So, so I feel like when you set it up the way you really envision it, that 24/7 thing isn't, it's not that daunting. It's like your baby, it's like literally like your baby. Of course you're going to get up in the middle of the night and feed your crying babies. Right. And of course I'm going to make sure the floors aren't ruined at midnight. Uh-huh. Things like that. So I think the main learning curve for me was just understanding how business works in general, because I'm just not right brain minded thinking. It's not like I'm more creative minded. That's just my background. Did I say that backwards before? You know what I meant.
Yep, I know what you meant. Yeah.
So in terms of just dealing with, okay, well, how does this work financially? Like literally, how do I pay myself? I mean, how much do I keep in the bank? Like, I don't even know these things. Yeah. So I had to start asking my accountant, and then my accountant would lead me to this person. And then, and I watched a ton of videos as well about any subject known to man. So I started off like, I needed my website. I needed all these little things. I had to watch the videos to learn about each step, and then watch the videos about QuickBooks, and then watch the videos. So I'm like, that's time consuming, but it's free, and it's out there. Like that's really good to know, because back in the day, you probably had to hire someone to help you kind of hold your hand through the process. babe. My husband is fine.
Hey, Mike.
But now we have all this free information on the internet, and that was awesome, because almost like each step of the way gave me the next key to the next step. Like now you need this, now you need that, especially how the programs are so integrated now, like the softwares, your scheduler, and, so it really wasn't too big of a learning curve there, except for just time consuming, aside from the time. But I knew it was just going to be the setup. Once it was set up, I could, walk away from that. And that's how it was. So that was, it's just something you got to plow through. The beginning is a little difficult. You really, you got to set all that up. And there's a lot of learning. It's not too difficult to get all that. I think the thing that is more difficult is if you have a knack for business and how to make all that work, and do you grow or do you franchise, and all these thoughts that happen, because you have to like allow the business to take its course, because it ends up having a life on its own. Because I honestly just never thought this was going to happen. It really just happened because it started growing. It like just was an idea that grew. It took on a life. So I feel like if you're not prepared to go with it, if it wants to grow, then it might fizzle like my old business. It's like I think you just need to be prepared for all of that growth. So, I think the next stage of the learning curve, so to speak, is going to be more challenging for me than the first, which was the setup, essentially.
Like trying to figure out. Go ahead.
Yeah. Well, at this point, I'm trying to figure out if I'm going to have a second location in Tampa, and if I do, how do I replicate what I'm doing? Like, this brand, like if this is a brand, it's not so easy to just have, because in my mind, if I just have neurosomatic therapy and the Cane School, because all of the Pilates people in our community are from the Cane School. So if I have these strong techniques and bring them together, nothing can go wrong, right? Well, that's not true. So I feel like if I'm really trying to create a brand, I have to have somewhat of a method. So it's like, I still have to bring together my vision, what I see is important. And it's like, wow, that's a lot of responsibility. So do I even want to go that route? So then it's like, because if I stay small, and not that small is small per se, like in terms of grandiose versus,
more just like physically small.
Yeah, physically small. Like I might be able to spend more time with online learning, and that's another way. Because I think the point that I'm trying to make, and I read this in a book, is that like the entity does not stand still. It's either going to grow or it's going to fizzle and die. That's life. That's how life is. So it's like now I have a lot of decisions to make about where I want to guide it to grow. So that's the next stage of learning that I think was the big learning curve. Because to be totally honest, I did a lot of the work that had to be done in the front desk for some of the time at St. John Clark. So there were times where I actually got a really good learning experience there. So I think that lended to being able to navigate through all that office stuff.
Yeah.
I did a lot of it. So that was helpful. So if anyone has a chance to apprentice or be in an office or trade some office time for treatment or whatever, however you can get interested in the back office. I think that's, it was helpful for me to be in that environment, because I don't feel like much had to be acquired in terms of knowledge for that after being so close with that group in the office. I think it's more that, like I said, that next stage of like, where do you want businesses to go after that first stepping point? And then if I really am a brand or a method or whatever you want to call it, what is that? Is that teachable? Is that just plucking from these techniques that I'm putting together and just always having that as my base?
Yeah.
Because I really felt like it's for me, it's already grown. So
you've taken what you learned already and like created something new out of it.
Yeah.
You've made your own treatment, baby.
Yeah. And it's not like I'm very pure I'm a purist, actually. I'm very pure to the methods that I learned, because they're good because they work. I just put them together. And that's exactly what Paul St. John did.
Yeah. Right.
You know, and so kind of learned from my teacher, I guess, like how, it's like, this is what I did as a dancer. This is what I needed when I didn't have the money to see a therapist. I worked on my alignment. I worked on, you know, pure alignment with exercise. I mean, that was huge for a ton of my injuries. I remember my shoulder injury. I didn't stop moving. I had to keep performing. I performed with a dislocated shoulder that I kept putting back in during the show. And I mean, this thing nagged at me. And because of my leg length difference, it was my concavity and my thoracic. This shoulder was an issue for years. I can't even tell you how many years. I would have to like do some isometrics right before entering the stage. Otherwise it would pop out of socket.
It's like basically just falling out of the socket, then?
Yeah.
Wow. Okay.
So I literally would have to do just like a few, I would put my arm, I don't know if you can see me, I would do just like a few 90-degree like isometrics with rotator cuff right before entering. And that would be just enough engagement so it wouldn't fall out of socket again. So, it's so interesting to put everything I've learned and kind of think about all these crazy injuries that I've had. You know, when I learned muscle activation technique, that's exactly what we were doing. Those 6 seconds, 6 just light contraction. That's what I was doing, not realizing it, of course, you know. So that was kind of neat. Like, I had a version of the therapy that I'm now doing that I was doing to myself.
Yeah.
Not being trained at all, just kind of with intuition. And so having that background with the athleticism and the injuries, I think I can translate that to a lot of my clients and say, look, like, you got to take care of this. You can't just expect this 1 hour with me, you know, and I've learned so much when I started integrating the exercise, because I feel like I can finally tell my clients this, because it's so true. I mean, they can't expect that 1 hour to have things hold in place, you know.
And how do you convince them? Because I have this problem. I don't think my patients do any of the homework, because, you know, when they come back and I'm like, they're like, did you do the homework? And they're like, oh yeah, I tried it a couple times. Like, I don't think you did it at all. But I haven't got that skill yet of like being able to convince them of how important it is. And I think a lot of that comes too from lack of confidence. Like, I am so impressed with your movement background and like the way you see the body and how like all the parts and puzzle pieces make sense to you in this flow. And do you think, like, I'm sure a lot of that came from being a dancer and just being in your body and watching bodies so much. Did Pilates, like, do you think Pilates training is really good for helping you understand like the pieces and how the body flows together as a unit?
I think it can be. I think any training can be good or bad. You know, you can get an amazing trainer and you're just going to learn so much information, or you can kind of get the online version where you know, it's okay. But I think for sure. I mean, I think about all my movement background, and I feel like I get a lot from when I studied the Limon technique, Jose Limon, and his background was Bonnie Bainbridge Cohen.
Oh, okay.
Kind of like movement therapy, Feldenkrais. So our modern dance warm-ups were often this like movement therapy exploration stuff.
Oh, okay.
So I had Alexander technique, Feldenkrais. I had all this, I'm forgetting names of techniques, the Klein technique, which is just like various different premise behind each technique, but essentially movement discovery techniques, right? So I got that in college, right? So I already was exploring that aside from dance. But what I really saw, when you look at with dance being kind of natural movements, you can see with the history of dance and some of the more classical techniques, you really see synergistic couplings. And that's where I pull a lot of this stuff from, which would be like, you know, for instance, like with varus knees and the supination would be the synergistic coupling with valgus.
Okay.
You know, because this is how bodies move. And then that's the more classic. But then when you look at the more kind of really deep rooted modern stuff that I was talking about, we also studied the reflexes of human development. So unilateral, homolateral, axial, like all these places in space, Bartinian, all these interesting techniques that I didn't think much of it back at the time, you're like, this is weird. But now I'm like, God, that was really cool, because we were just exploring with movement, and that's what we do. We're human, and look at animals. That's what they do, like watch cats stretch. They only stretch a certain way, like most of them all do downward dog, downward cat, they stick their leg out, little thing. You don't see that. You don't see that much variety. Same with humans, it's like we have this form. There are only certain things we can do to like stretch this or stretch that, it's all been laid out before. So it's just a matter of how you want to put it together. And then you look at what Feldenkrais did, and he just went, shh, he took all that and said, I'm going to mess this up. We're not going to do synergistic. We're going to really confuse your nervous system. And what that does amazing things. So it's like, wow, you can see how working with the grain can actually get you somewhere, and also working against the grain can get you somewhere. And it's all just movement exploration. And I think the bottom line there is move. Because even if I'm saying something that's like a double-edged sword, but even if you're going to do something wrong, which I preach all the time, if you're exercising the path of least resistance, you're really never going to get better. But at the same time, if you're exercising at all, you're better off than if you're not. So, but that exercise piece is so important. And when I started really working with each, kind of breaking down the curriculum that when I taught at the Center for Neurosomatic Studies, breaking down the curriculum of this is the distortion. We learn these muscles do this, and kind of use that as a window. Well, how do you exercise out of that distortion? Yeah. When I started thinking that way, okay, well, it can only be this, this, or this. So we could, we could extend, we could self-massage, we could, really break it down like, just like bullets, just like a really clear outline and not too frilly. It's so simple, and it really, it's effective. And it's like, you can be creative within it, that's what I was trying to impart when I taught the class too, is that, this is what our chart says. So we know how to release these tissues. So if you really know how to release the tissues to get the alignment, then you should be able to deduce how to work with exercise to get that alignment, because you already have it in, these attachments, this is what's pulling. But what really took it to the next level, because that's kind of compartmentalized, right? So that's a little bit not as holistic as we truly operate. It's like if I have a head tilt, I could go, exercise it that way. Or I could figure out how my whole body is lending to this. Why is, what else? So then when you zoom out, it's like, oh, that is countering this hip, which is there because of that foot. And then maybe this exercise, and then this hip exercise, and this foot exercise, maybe that doesn't even make that much sense. It's helping them. That's cool. So I started going to the next level with some people that are open to it, and really cool things are happening when you're saying, you know what, let's zoom out. Like, I know you're here for this, but if you really want to get to the root of this, let's zoom out a little bit. Yeah. Look at this pattern and look at the fixations. And if you're with me on this, let's really explore how to get your whole body out of this head tilt. Yeah. And so I try to open up people's minds about, it's not just body parts and pain here, but it's the whole tension system of the body. It's like the whole fascia. I've gotten super, super into fascia since I've studied the OOV and did Gil Hedley's course. Because especially with the OOV, and I'll get into that in a second, so I'm not jumping around too much. But really feeling how the littlest tension from, repetitive motion, whatever it's coming from, but that little bit of tension, what it's doing to everything else. So what the OOV shows you through a magnifying glass is that little tension, because it's a balance device. That little tension is going to make you fall off.
Uh-huh.
Just that. So if it's that powerful to make you fall off of this balance device, what has to counter tension in the body in order for us to just operate?
Yeah.
And that's what the OOF training really opened my eyes, because it's really a delicate balance. It doesn't take much to find that tipping point on it. Have you played on that one yet?
I just, Brunella showed it to me because we have one at the clinic, and I played on it, and I like lifted up a heel and completely crashed. So I definitely, I want to do one of those classes.
We're working with it a lot. One leg coming up. If you tell someone to just lift one leg, they're going to lift the leg against their obliquity. They're always going to, it's because what that OOF does is it's unstable in the transverse plane.
Okay.
So that's obliquity is in the transverse plane, right? So it's the oblique slings.
Oh, okay.
For the trunk. And this is where I've gone off into a new kind of avenue of research and how this plays into all of the distortions that we're taught, because there is an as above, so below that goes even further than C1, 2, 3, L, 4, 3, 4, 5. You know, there's way more than that that has to do with the oblique slings and that delicate balance system. So I'm at a point now that I'm not correcting obliquity unless I'm looking at their shoulders, you know, because it's that oblique sling system. It's that cross pattern.
Oh.
Yeah. It's like, it really has, it's really, really opening my eyes with how the opposite, you know, and I've heard of this before in other therapies, but I'm like, yeah, sure, opposition, you know, but really looking at these oblique slings on the OOF and how one is so dominant. It's like, I'm solid. And the other side, you're like, no, like you're on the floor in 1 second. You're like, how would you fall like that? But that's how we are in space, in life. We are constantly creating this like asymmetry of tension. That's why when we're 60, 65, whenever it happens, we're breaking down, and it is painful. And it is like, I'm done. Your body's just done at that point.
So when you look at the body like so holistically like that, how do you find like the key to unlock it?
Oh my gosh. Well, that's part of my problem, because I am all over the body, you know. I'm not like what they taught us, where, you know, it's like we hone in, you know. I want to palpate. I'm doing a lot of palpation, and I want to find, you know, almost like a sonar, what is the densest out of everything that my chart's pointing to, and also what's hurting them the most. That might not be where the densest place is, but usually there's a relationship. So, because I mean, ultimately as human form, if wherever that density is, there's no translation of energy.
I think stagnation.
Yeah. So it's like, if I have my chart and I have my overlaid scoliosis pattern and my overlaid, like what I've seen them do in movement, and as I overlay, I kind of picture translucent paper. I have those in my brain, you know, and whatever like hones in on an area, then I'm using my palpation. I'm like, okay, out of those, like say 3 spots, what's the densest? Whoa, this is like plastic. We got to get through this. Like nothing's going to change if we don't get through this. That's kind of an example of how my brain works.
Interesting. Yeah, I would totally sign up for Shila LaGrua therapy training. So let me know when you come out with that.
Oh man, I have some wild ideas, but why not, right? Why not explore this stuff?
Well, and I just got back from a yoga festival. So, you know, like when you're at those things, you're surrounded by like all of this amazing positive energy. And it was like, they just kept repeating in a bunch of different workshops from different teachers that as yogis, we have a responsibility to shine. We have a responsibility to shine our light out into the world. Yeah. And it's like, you can just tell when you're talking that you just like, this stuff lights you up, and it inspires you and fires you up. So yeah, you don't have a choice but to share all this with people.
Exactly.
Yeah. Well, and I promised to just take half an hour. So I wanted to just take a look at my list here and see if there's anything else super important on here I wanted to touch base on. I was curious about the workshop or the classes that you're offering, like at the museum and you offer some like free Pilates classes on the weekend, I think like on Sunday or something like that.
Mm-hmm.
So do you do that like in an attempt to raise the visibility of your clinic, or is it just like as a benefit to your patients, or what motivates you to do that kind of stuff?
There are a couple things that motivate me to kind of have Body Center end up the way it has. I mean, like I said, it was this little idea and then it just turned into something. But there's a ton of yoga everywhere. It's a little bit saturated.
Mm-hmm.
St. Petersburg doesn't really have that same interest in the Pilates world. Well, it hasn't been available here that much. So not that the interest wasn't there. So when my first business was yoga and Pilates, and I actually noticed that that location had more of an interest in the Pilates classes than the yoga classes. When I work on my own version of therapy, I feel like there has to be an element of strength to hold something and you know, to create a new pattern.
Mm-hmm.
To create a new pattern. I also feel like the body might need to release and stretch. I felt like using Pilates I use Pilates and yoga equally.
Okay.
Personally,
Mm-hmm.
not my other people there at the center, but personally, I talk about breath. I stretch people. You know, I'm equally as interested in yoga type movements and stretches and therapies as I am the Pilates stuff. What I love about Pilates is we get nitpicky about of course about the alignment with both, but pelvic floor, inner unit, diaphragm. So it really organizes the trunk and gives the support underlying all of that postural stuff that we're trying to, you know, have our clients line up. So in terms of the exercise element, it's just been to me always something that I feel like if our clients don't understand that this is something they have to do to feel good in their bodies, then I'm doing them a disservice if I'm not really just making that clear, because I know in my body, if I don't move, I feel like crap. Why wouldn't you?
Yeah.
Why wouldn't you? I mean, what makes you exempt from that? So that's just how it is. You got to move it or lose it. And I just feel like having these offerings gives our clients no excuse. You know, we have this free, you know, by donation Pilates class every Sunday morning at 11. And the woman who teaches it is also a restorative yoga teacher, but she's teaching a Pilates class. And it's the cane style Pilates. And a lot of people don't know what that is, but like I mentioned before, it's like therapy in that center. It was like it was like a Pilates school, but we were all like we're looking at obliquity. We're like, whoa, which way is the pelvis facing? You know,
wow.
Like, are we going to be at the front of the joint capsule or the back of the joint capsule? Like super geeking out on movement, you know? So it was like that kind of place. And that's how our Pilates classes are pretty much formulated, to kind of explore where that neutral place is, how limb motion and biomechanics all fit together, and how can we make it as efficient and, I don't know, just the best mechanics for our body. So then on top of that, then we strengthen, then we add load, then we challenge it. Not first, you know, not let's like get out the bands and start doing crazy stuff. Like we really want to set up, get our breathing going, you know, so there's no expectation for fitness. So that's what I wanted to really offer when I felt like, okay, in this town, you know, and all over the country, you know, yoga is really saturated right now. Pilates has been there for a while and it's still there, but to me, they're one and the same, to be honest. It's like, yeah, you can have a focus, but you know, movement's movement. And I approach everything yogically the best that I can. So, yeah. But for me, I felt like that was more marketable to use Pilates and to get into the community with it, because that's already happening with yoga. And a lot of times yoga is like my number one client, the yogis, the yoga students.
Yeah.
So I wanted to be a mindful movement practice. And so when we do like Body Center Pilates classes, I want everyone that comes to know that they're gonna feel safe. Like they're gonna be able to work out and get the challenge, but not, not hurt themselves. And I kind of want all of my clients to feel like they can come to any class and know how to modify and know how to sit out and just participate, to get that community feeling so we can lift each other up and just help each other feel well.
Yeah. And that was one of the workshops I went to this weekend too. They talked about like the five elements of elevating your consciousness. And it was something that they actually developed between the two of them, the two teachers, but then they went to a Deepak Chopra retreat and he came up with the same five. And it was like exercise, movement, sleep, and community was one of them, and meditation. Those were the five. And it was just like the whole weekend just like really drove that home, how important it is to have that community and that tribe and that like interchange of encouragement with other human beings. It's like, it's like a physical, spiritual, emotional need. And I think it's something that a lot of people are super disconnected from. It's like we don't, it's like people don't think that sleep and community is that important, but it's like one of the 5 pillars of health.
Totally. Yeah. And that's, bringing back that community again, that's what was definitely missing in my first business. And I was afraid that if I was going to hire out and I just was like, well, what's the point? Then you don't pocket the whole percent or whatever, however you want to look at it. But truly, I feel like that is that's what is required to grow. You need this like fertile ground with lots of ideas and energy underneath it to birth these ideas, these big ideas that I have. Yeah.
That's awesome. Well, I know I've taken a little bit too much time, but I loved this conversation and I love your vision of the body and you're what I aspire to someday. So,
oh, Heather, thank you.
Yes, thank you for being in my world and for taking the time to talk to me. And let me know when you develop your therapy. Are you guys doing any more like cane Pilates trainings at your studio?
I probably will eventually. It's hard to know because the way it happened in the first bit, Maria and I wanted to teach it, but it ended up we weren't qualified to. So we actually want to do our own.
Cool.
And in the end, it might not be cane, even though cane is everything we are. So it ends up being political and silly, but somehow we're going to probably have to do another training at some point.
Okay.
Whether it's cane or something that Maria and I put together that is cane-esque.
Okay. Awesome.
But it's not on the horizon very soon. What's on the horizon next is we're trying to get some of our workshops as continuing education.
Oh, nice.
Credits that you could receive. So I'm trying to create a curriculum for the scoliosis one, and that's going to take a little bit of time. It's happening. I would love for it to be really thorough and really, just really complete with what I want to put out there. And I feel like every time I do a practice workshop or it just falls short. So there's a lot that I want to put in, but I don't want it to be overwhelming, So right. I just have to create that. And so that's what's really next on the horizon is trying to get continuing education to be a provider.
Yeah, that would be really helpful. Like I typed up the notes from your last workshop that you did on scoliosis, and I had a patient who has like a really severe one. And so I actually pulled my notes out, set them on the desk, and I had to like draw the picture on the chart and then look, and I'm like, okay, pillow here. And
how did it go?
It went really good. And I'm like, breathe into here. And she was like, oh yeah, that does feel good. So thank you.
That's awesome.
Yeah, it was very helpful. All right. Well, thanks a lot for your time, Sheila. I really appreciate it.
Thanks, Heather. And, anytime your time here might be short, but I very much enjoyed it. And I hope through technology and Skype and your YouTube channel and all this stuff, we can always be in touch and always have this community.
Yes, definitely. All right. Well, you have a fabulous night.
You too.
All right.
Bye.
Thanks. Bye.